You can see only as we in Nepal, we first highlighted in the Nepal. Actually, most students used to come from India. Then second position is Nepal. So I am telling about this present at present what is happening. Nepal, see number of male students total admission till date after 34th batch. Total students 187 of male, 99 female, and total 286 Nepal students got admitted. And passed out 2019, 219 students passed, and still to represent foreign students are total. Foreign means Nepal students are 67. So the out of the got admitted 286, passed 219, and till now actually studying 67 students. And in recent years they are becoming more and more increased number. We are getting students more and more from Nepal, because actually Nepali students don't take it otherwise. We found Nepali students are very intelligent and they're polite and disciplined, and they got actually a post-graduation degree. They got some chances in they passed in USMLE, then Australian Medical Council. They went there for MRCP, MRCS. All the post-graduation percentage of doing this post-graduation degree is higher in Nepalese students. That's why in that for the last 2 to 3 years we are inclined that we will get foreign foreigners for the Nepalese. We give preference for the Nepalese students. In the last year also, and year up before that year also. It also same statement of present students of the AMC, the same I have shown you earlier. There is local students, foreign students from 222, local students 333, and total of 282. If it were a big screen, I could show you, but I am just telling that this is the OPD. In a hospital, there are services. What are the OPD services? You know, if you become a doctor, you know, there is medicine, there is surgery, there is pediatrics, there is skin and beauty, there is ophthalmology, there is ear, nose, and throat. So all the departments, as per the requirement of the government, for to run a medical college, we have all the required departments, and besides that, we have also some specialized departments and super specialty. We are adding for the service of the patient mainly. And our hospital is actually 24 hours open around the clock and around the year 365 days. So we don't have any holiday. There is holiday for the say weekly holiday is there, but on that holiday also, in all subjects, consultant must be present there. We have consultants for that day. He get holiday for another day. In your country, holiday, which day is holiday?
Saturday.
Saturday. Saturday is holiday. So hospital is doctor's holiday also Saturday?
OPD.
Hospital is closed?
OPD, yes, OPD.
Saturday. OPD is closed. And OPD is emergency runs on Saturday. Okay. But our holidays in our hospital, holiday is Tuesday. But on holiday, emergency and other services is open, and also for the general patients, the service is also open, and all the professors in all the departments are serving round the clock, on duty round the clock. So practically, we have no holiday for the patients. Patients, we give patient service round the clock and round the year. This is an excellence. No other medical college, so far my knowledge goes, gives this opportunity. And other thing is your teacher and our doctors who are serving in the Jerusalem Medical College and Hospital, they are non-practicing. They are not allowed to practice nearby or at the, because their only duty is to teach our students and treat our patients. So they teach you in the morning, in the hospital, they teach you in the morning session, also in the evening session. In other hospitals, actually the college time is up to 2 p.m. Then doctors go away. Then there is no evening practice, evening session, and evening wards. There is bedside teaching. We have bedside teaching from the third year to third year, fourth year, fifth year. Bedside teaching both in the morning session and evening session. That is very important for you for being a doctor, to develop your clinical skill. And another thing is actually we have 513 beds, but bed occupancy is how many beds do you have is not important. Important is the how many patients is admitted in your hospital. And bed occupancy rate is always more than 80% in our hospital. So you will get a good number of patients to develop your clinical skill. That is what is happening. My son, I am telling about my son. My son was used to study in medical college at Dhaka. So then, but he was not getting sufficient patients to develop his clinical skills. Then after fourth year, he came to our medical college. So fourth year he studied there, fifth year he studied there, internship he did there. And after doing that, only after 4 months, he passed in the Australian Medical Council Part 1, then Part 2, then other things appropriately they required for the registering exam. And before 3 years back, he went to Australia, and he and his wife is now studying in Australia, serving in Australia as a doctor and doing position over there. So I'm telling why I'm telling this. I'm telling that because in our hospital there is a very good scope. If you want at all to develop your clinical skill, that will be just during your examination, whether it is a private MRCP, whether it is USMLE in clinical part, that will be examined, and that will be given very much emphasis. And that's why the medical students, whether from Nepal, or Bangladesh, or India, whoever passed from our medical college, got chances in abroad. Yesterday night, I met some of our ex-students. Our principal sir and Babar Ali met our students. There are around 25 ex-doctors who were serving in Nepal. I invited them, came to a hotel for a dinner. We all had a get-together yesterday night. So they are right now. They are actually they are only serving in Nepal. Even they don't know each other. They are from Judas Medical College. Only whenever we came here, they were together. They came to know each other. And last night, and I also once I went to Melbourne. They are also in the Melbourne airport. I found 26 of my students came to receive me. They didn't know actually from board, Qatar Airways on board there was Wi-Fi. I took a shot. My son and my wife, they were on the way to Melbourne. Just I posted that in Facebook. I don't use actually social media. I don't get time and don't have time to use. But seeing that, they found out the flight and they rushed in the airport, and all of them came to receive me. So that it is a good, proud for us. Our medical college as a teacher for us, there's a big number of doctors came in the airport to receive us. So I wanted to give you a flavor that how many students in abroad we have passed from the medical college and doing job in abroad. It's not doing job in abroad, getting job in abroad, getting higher degree for going abroad. It's not that much easy, you know. So base must be. Actually, at the very last message is that for going abroad and for doing higher degree, your knowledge must be sound. You must have sound medical knowledge. We offer you that opportunity, and just depends on you whether you will get the opportunity or not. But we offer that. We have that facilities. So it's a journal actually, the journal is a very important part of wherever there is a research work going on, wherever it is a important part of an institute. The research work must go on there. So research work always continuously going on our institute, and that is published in the journal, and that is the index journal, and is worldwide distributed. JMC collaboration, there are several collaborations, the WHO, IDCR, government, non-government organizations. These are the studies. Beside education, these are the research studies and collaborations. We helping government and non-government and WHO, all these things. Future plan, actually, expansion of administrative block is going on. Postal surveying, expanding international collaboration and research and innovative works all are going on. Is actually new academic blocks are building of new academic blocks are going on. So we are in the goal of developing JMC as shaping future healthcare leaders, while as well as Center of Excellence. What we are doing now. That's all from us. Let's thank you. If you have any questions and queries, you can ask us. The principal is here. I shortly just it would have been a big screen. I could tell you. So our principal, I am telling our principal to tell you something in front of you.
So thank you, Honorable Director Sir, for your nice presentation. So now is the session, open session for sharing the queries and questions that you have regarding Johor Islam Medical College, your admission and anything else. So let's start.
Do you have any
Question,
queries? Any
any
questions?
query?
Why should you select Johor Islam? Why do you want to be admitted to be a doctor?
Sir, language
Yeah.
चाहिँ English, why in India, if language are same or different?
What? Please excuse me. What is your question?
If study in English or they are same language, Bangladesh language.
Language.
Teaching.
Our instruction, medium of instruction is English.
English?
Everything is written in English in the textbook, and the question, answer script, the teaching and learning process is done by English medium. And for communication with the classmates, junior, senior, you can use any language, your Nepali language, with the Nepali friends, Nepali junior, senior, with the elder brothers, other native students. You can use either English or you will learn Bengali very soon, because when you will be admitted in a medical college in Bangladesh, you will, in clinical part, from third year, in clinical classes, you have to come in contact with the patients. You have to get the clinical knowledge. To get clinical knowledge, you have to examine the patient, you have to take the history, you have to diagnose. For this, you have to communicate with the patient. Then, for that, you will have to use Bengali language, because the patients are not that educated. Majority of the patient, as it is in the rural setting, these patients are coming from the rural villages and they are not that much educated, so that they will use Bengali language. And to take their sufferings, what they are telling, you have to communicate with Bangla. So that is not very difficult. I have been working in Johor Islam Medical College for more than 30 years, and our number of batches of students that are we admitted is 34. 34 batches of students already admitted in our medical college. Among this 34 batch, now 28, 26, 20, 26, 7, 8, 28 batch already passed out, and rest of the batches of students are studying up to J34, 29, J30, 31, 33 and 34. These 4 batches of students now studying in our medical college. From the first batch, I had the opportunity, privilege to get the students from the very beginning. And I have observed the foreign students, those who are coming from different countries, they get very much quickly, they pick up the Bengali language. That's very difficult to pick up this language. So that is not a major problem that you are thinking. It will be no major issue.
It will be very similar
Automatically.
very similar to Nepali
Yes,
language.
very similar to Nepali language. So some Nepali words I can understand when you will talk in Nepali language. Like that, you will very quickly pick up the language. So that will not be a major problem. Is it okay? You could understand? Thank you so much. Yeah,
So,
please.
what about our admission deadline?
Admission deadline, as declared by government. It is 15th January, 15th January, 2026. Is it okay?
So is it for the form for Bangladesh or is it for Jawahar Medical College?
No, it is for all the medical colleges in Bangladesh.
Yeah, that form is till January 15. Yeah.
Yeah.
But what about our enrollment procedure?
Enrollment procedure will be continued up to 15th February.
15th.
15th February. Is it okay?
Yes. Thank you.
Please. Feel free to ask any question.
Why,
This is, yeah.
why the number of Nepalese and Indian students is more than other country?
Nepalese and, repeat the question please.
Why the number of Nepalese and Indian students is more than other country?
More than other countries. As because these countries are nearby to us and we have developed communication with these countries and we have limited seat for foreign students so that we don't need any other country to look for. But if the students from all other countries of the world, they apply, we accept. Right? But we keep our target to these nearby countries. This is nothing other reason. Is it okay? Okay.
So as you just said,
Yeah.
as you just said, sir, it's in a bit a rural place.
Yeah.
And what about our basic needs, like even books? We do always need to
Yeah,
visit Dhaka.
that is
or-
available in our library.
Yes.
You will get our college library,
Yes.
as well as there are bookshops in that locality
Yes.
nearby the college, or if reference book is required, you have to if you need to pick up some other rarer book,
Yes.
you can go to Dhaka book market and you can purchase it very easily. So quickly accessible, and on the same day you can go and can get back. Is it okay?
Yes.
So many fast food restaurants and other restaurants.
Yes, there are many facilities, fast food restaurants and other enjoyment
Inside the college premises or outside?
within the college and outside the college. Everywhere you will get that. Yeah. Please, feel free, no problem. Anything, any issue, any question, any query.
You can ask related to food, education, passport, visa, anything if you are interested. Eligibility criteria.
Regarding the food facility, because in this country you are accustomed with your food habit, Someone are vegetarian and someone are non-vegetarian. This is the major difference from other countries. That all are non-vegetarian or maybe some vegetarian. But in these countries, a good number of people are vegetarian. So in our hostels, there are separate different messes. Mess for Kashmiri students, mess for other part of the Indian students, mess for Nepali students, vegetarian and non-vegetarian. Every facility is available there. So you will feel no problem having your food. Any kind you will get there.
Is mess and hostel included in the admission fee?
Mess charge, hostel seat rent is included in that.
Yes.
But for food, that is not included. But because that will depend on you, what food you like, what food you want. In the hostel, you will have the facility, as well as you can take the facility from the nearby shops, so that it is not included. But that ranges from $50 to $60 per month. That is the average. Okay.
And what about our internships, sir?
Internship, our full furnished modern hospital, 500 bedded hospital is running very well, and you can do your internship there. There is no problem. But if anybody likes to do internship else other than that medical college, that is also acceptable. As per government direction. You will have that facility. Okay. Yeah,